I am Rachel High, presenting our work, Brain Functional Connectivity Pattern Correlates with Urinary Leakage in Women with Overactive Bladder Syndrome. Here are our disclosures. Overactive bladder syndrome is characterized by urinary urgency, usually with urinary frequency and nocturia, with or without urgency urinary incontinence. There are burdens associated with overactive bladder, including personal, societal, and healthcare burdens. Overactive bladder is associated with depression, especially in older adults. Many studies have associated overactive bladder with mood disorders such as anxiety and depression. The quality of life impact is even greater in the setting of urinary incontinence with urgency. Each of these disorders have been shown to have biomarkers on functional neuroimaging. Functional MRI is a type of functional neuroimaging where biomarkers for bladder dysfunction and mood disorders have been described. Activation is measured by blood oxygen level dependent signal changes. Correlation of those activated regions across the brain can provide information on functional connectivity. The focus for this study was resting state functional connectivity. Our primary objective for this study was to investigate correlation of resting state functional connectivity with bladder symptoms and, secondarily, quality of life measures and mood disorders. The study cohort was recruited for a clinical trial, and this is a presentation of data prior to randomization. Women presenting to urology and urogynecology clinics with idiopathic overactive bladder who were 50 years of age or older were included. They were excluded if they had elevated postvoid residuals, or if on screening questionnaires they showed signs of severe depression or anxiety or cognitive impairment. Those also excluded were women with contraindications to MRI or those who had had OAB medications or pelvic floor physical therapy within the last 6 months. When patients arrived to perform the imaging protocol, they emptied their bladders prior to getting into the scanner. When subjects were in the scanner, an anatomic scan was performed, then resting state imaging. During the resting state imaging, the subjects were instructed to look forward at a screen. The screen was black and had a white cross on it. They were asked to look at that screen and to avoid falling asleep during this period. From this, significantly activated voxels were identified, and resting state functional connectivity was measured and represented by FC-SIM values. The FC-SIM variable stands for Functional Connectivity Similarity. This variable describes the similarity of the functional connectivity in one subject relative to the others in the group. All subjects were assigned an FC-SIM value. Higher FC-SIM values indicate that that individual had higher similarity to the group. Lower FC-SIM values indicate that that individual deviated from the functional connectivity noted in the rest of the group. The primary outcome was analyzed using a bivariate Pearson correlation of the FC-SIM variable with measures of bladder function. The transformed scores were calculated for the two subsets of the OABQ short form questionnaire, and bladder diary values were correlated with FC-SIM. Additionally, other patient characteristics like age and BMI were assessed for correlation with FC-SIM. Depression scores from the patient health questionnaire and anxiety scores from the Hamilton Anxiety Measurement were included and measured for correlation with FC-SIM. Patient medication lists were reviewed and an anticholinergic cognitive burden score was calculated. Here are the results of our study for the 12 women who met eligibility criteria. There were no subjects excluded due to poor image quality or due to the exclusion criteria. Here are descriptions of the patient characteristics. The mean age was around 62 years old, and BMIs were on average in the overweight or obese category. Here are the mean values for the anticholinergic cognitive burden score and the depression and anxiety scores. Here are descriptions of the bladder clinical variables. The patients had on average over 24 hours, 12 voids, 9 urgency episodes, and 5 leakage episodes. The transformed scores from the OAB questionnaire short form are listed here. Patients also filled out a patient perception of bladder condition questionnaire, and the mean score is noted here. Here are the results of our primary aim. As you can see, the correlation coefficients are listed in the column and the corresponding p-value. None of the bladder diary measures other than leaks had significant correlation with FC-SIM. None of the patient-reported outcomes significantly correlated with FC-SIM. Baseline characteristics, other than depression score, did not significantly correlate with FC-SIM. There was an inverse correlation of depression score with FC-SIM that was significant. Here are scatter plots representing the two variables that significantly correlated with FC-SIM, depression scores and number of leakage episodes. As you can see, they both had an inverse relationship, meaning as those scores or number of leaks increased, there was decreased FC-SIM. We interpret these results as an increase in the frequency of leakage episodes decreases the similarity of the resting state functional connectivity. In other words, more frequent leakage correlates with functional connectivity patterns that are less similar to the group. As there's an increased burden of depressive symptoms, there's decrease in similarity of resting state functional connectivity. In other words, women with greater depressive symptoms had functional connectivity patterns that were less similar to the group. In conclusion, in women aged 50 years or older with overactive bladder, more frequent leakage is associated with a divergence of connectivity patterns. A less predictable functional connectivity pattern may indicate a more severe disease state reflected clinically by more frequent urinary leakage or a higher burden of depressive symptoms.